start now. This topic was actually given by the recent classes at breaking the silence to Akan Dimension. Kerala Transplant is a very big part of our program. There is very big. There are a lot of issues around agreed organization. So, what would you suggest to increase the rates for fixing the work communities? Transplant centers are open transplants are usually located in tier 1 cities and are usually private hospitals. But what happens is, it is the public hospitals that cater for most of the chronic patients. So our public hospitals geared up to do transplants. If not, the step is to gear up to boost public hospitals to do transplants. If they're not in a position to do transplants, they should be able to potentially identify brain death or potential brain death and transfer them to the nearest transplant center if at all possible. So, let's say to about our city itself. So, as of now, Kakinada, the general hospital is not able to cater to doing brain transplantations. So, if they are able to identify potential brain death patients, if they can transfer those patients to a transplant center or at least a transplant retrieval center, whichever is the case, that would be a significant step. That is what I feel. And not just the general hospitals. There are only 3 or 4 hospitals that do transplants. The onus is on all the private hospitals, all the smaller sectors. The incentive is that each of these hospitals should train their should train their ICU staff to be able to recognize brain death. If this is done, if we are able to recognize brain death before there is a significant deterioration, if we are able to transfer the patient to an organ retrieval center or a transplant center, we should be able to save innumerable number of human lives and cut down on the transplant rate in this year. When basic if you have a patient, sick patient, collapsed and medicated. So you call that attention, means people just come in. Call that attention, the work was just 20, tell them, he's no more. The attendant started fighting. See, justice is doing up and down, why are you telling me? The ventilator was not a discovery. So he thought the patient was still alive and was saying this way. So what you said is perfectly correct, that common business is quite there and there is a trust gap. But what about state measures? What measures is the government taking to increase the donor transplant contribution? In the year 1994, 1996, between the 94 and 96, the Human Tissue and Organ Donation Act, the TOGA has submitted the sense of it has submitted as a bill in the parliament and in existence. And with this, there is a National Organ Tissue Transplant Organization, also, and it has its own reason. These things are the state organ tissue transplant organizations, SOTO and RODO. So, making this or bringing this into existence, the major aim of these national bodies the state-wide bodies or the regional bodies is to promote as much as possible the same thing. See, the main motto is to encourage mental fraternity or mental people and where possible, if they identify rated, to identify them as early as possible. In most of the ICUs, possibly we might falter, thinking that there is a chance that we ourselves even as a also, even beyond the patient attendance, we get emotionally attached to the entire many patients, thinking that we might pull him out of the possible scenario, even though we don't know that the patient is brain dead. We hesitate to declare the brain dead state. So, declaring, if at all there is a definitive, there are set laid out criteria for identifying a brain dead. So, adhering to the standard operating protocols, if at all on your routine norms, if you find that these are the standard operating protocols and according to this, the individual is brain dead. So, you should be calling the authoritative person, according to our senior physician or a neurologist or a neurosurgeon, is have to be declaring a person brain dead. So, the information should be given to the neurologist people and in their presence, you should be conducting the registered reflexes examination apnea test. And once you confirm that the individual is definitely brain dead, you should declare that there itself. And each and every, of course, coming to at least you can take the state or Andhra Pradesh. So we have it divided into 3 zones. So the each and every zone will be tapping to or taking care of the hospitals that are registered under the purview. So the intimation of the possible presence of a brain dead has to be notified to them. Simultaneously, you should alert,
I should say that each and every hospital, irrespective of whether they do a transplantation or not, they should be having their own pamphlets or cadaver coordinators. So because there is a conflict because the government is trying to increase the availability of these organs. First, they have brought a position of the identifying the hospitals such as NTORC. These are non-transplant organ retrieval centers. So basically, they doesn't do transplantation, but they are when accommodated to at least declare brain dead. And even though they have the infrastructure to conduct the operation there itself, so they have a well-maintained operation theater. So you can get the skilled person and you can harvest the organs there itself. And they can be transfer to the various places where it is needed organs. So NGO overseas and even in states of Tamil Nadu, in fact, the government has given. See, in the NGO overseas, if the institute identifies a piece of a donor, see the college or the hospital is incentivized from the state with 1 lakh cash reward. As well as, and it should be noted that one of the aspects should be utilized in the public sector. So with that, so that sort of like incentivization and the people involved with the identification of brain death, the staff and the LCs or the ICU doctors, because they need 50,000 rupees as an incentive. So for identification of the brain dead and the maintenance of the brain dead. Because most of the places, even though we identify the brain dead individual, most of us lack in maintenance of the possible brain dead because it is a completely different scenario. Maintaining the brain dead is not a routine ICU practice. So if you are not capable of maintaining the brain dead, you should make sure that what is the nearest organ transplant center which is capable of maintaining the donor till then suitable residents are found. So these are the steps which are behind. Apart from the nationwide, even the states have been doing this. Even see again, this society is much more predominant when you compare North India with South India. 99% of the transplants in North India are live, less than 1% are cadaver. Whereas in southern part of India, till Gujarat, the highest number of, we have almost, I don't say that 50-50, but again, at least 70-30, we are doing with 30% of our transplants are cadaver transplant, whereas 70% are live transplants.
The reason I'm asking this is like both of you mentioned about maintaining trained role. Okay, can you actually, because we all know, because we're part of the, how it is. Can you just give a brief outline of how you maintain the graded role for us?
You should be having a acceptable blood pressure of more than 90/60, when level of more than 65 millimeter mercury, then you should be having at least 100 of good cases. And then you should be seeing for the epileptic bias should be in the normal physical surveys because though kidney will not be significantly affected by epileptic bias, but human transplantation is predominantly relying on the sodium levels. So if at all the patient was into severe hyponatremia or severe hypernatremia, liver cells do not tolerate and do not go into harvest the liver submissing. So apart from that, lysine you need to be targeting the blood glucose level between 140 to 180 or less than 100. And you need to supplement if necessary the stress of steroids as well as the levothyroxine has to be given. And if necessary, you might need to give the oxygen response. So apart from this, you need to maintain the oxygenation. You do need to maintain the heart going within the acceptable limit. And these all the what involves in the maintenance of the organ transplantation.
So, colleagues, what is important is that all reversible causes have to be potentially ruled out. All electrolyte abnormalities have to be corrected. All metabolic abnormalities have to be corrected. So it is very, very important in that in maintaining a potential output of liver, the absolute amount of care that is given to a sick patient in the ICU has to be given and perhaps even more. Yeah. So as I mentioned, all these potential reversible causes, including drugs, neuromuscular relaxants, metabolic abnormalities, electrolyte abnormalities, all these have to be corrected before we start to try to certify a patient as vigorous. So that is the importance of maintaining an organ in the ICU setting.
So how you actually approach the family health? How you actually go about seeking for And all, even though you say no to that, but at that point of time, the winning family, from the winning family, it's a hard win. So only FC one win.
This is a very tough time for a family. A patient on a deathbed is what they see. So the family is usually in a state of shock. Yeah, they're in a state of denial. They would not be able to accept that their loved one who was happily roaming around up until an hour ago is potentially on a deathbed. Yeah. So the family will be in a state of agony, will be in a state of shock. So what is important is that before we talk about breaking it, we have to explain that to them. Unless a family has completely accepted that the patient is dead, we do not have to bring up our donation. So if the family thinks that the patient is still alive, if he's still breathing, if you ask for our donation, what you're asking for is prematurely stopping treatment and trying to harvest organs. So unless the family accepts that the patient is dead, do not ever without organ donation. So these two are entirely different things. The most important thing is to give time to the family. What the family needs is emotional support at that moment. So as a medical professional, you might not be able to give your time. So that is where grief counselors and transplant coordinators come in. They would be able to sit with the family. They would be able to show the empathy that is required. They would be able to counsel grieving families. And once the medical team has explained that the patient is dead, once the family has accepted that the patient is dead, only then do you approach the family about potential organ donation. These two have to be kept completely separately. If they are too close together, there's a potential of the family developing mistrust in the medical facility, and the family might actually confuse the medical fraternity then they're trying to harvest organs. So that is the most important thing that I would recommend when we are trying to approach family in terms of intervention.
Couple of things. What are the steps to allocate strength? We know also chart on one is being taken for the if all that's at the process.
Probably the time would not be have been much like constantly if again you are not you must say that recently hardly 4 to 5 days time in the state of Kerala, where the youngest donor there is a listener, elegant baby as well. She's just 10 months old. When this mother unfortunately met with an tragedy whom the parents have come up with you just nobody can think of that. I mean, it is quite difficult to comprehend that it's sort of this situation. They didn't want really to donate the organs of the 10-month-old infant. So the state of Kerala has given the full honors during the last performance of the last rites. This is the practice in states of Tamil Nadu since 2023. There had been a dual shoot wherein the state government shoots the district magistrate. The collector should come in person for the funeral this thing of the individual who has rented. In case the collector is already received some public work, at least a MRO level individual should be coming and attending the funeral from this thing. The same thing goes on in even in the Andhra Pradesh gives full state honors. Then even though it is not completely, it is a proposal state, not yet finalized, incentivizing the individuals financially as well as the government is even thinking of possibly giving some of their individual family members some sort of rehabilitation. Suppose this is in the particular in the proposal state, not yet finalized in the implementation. Whereas in the state of Odisha, they give 5 lakh rupees to the state family who has donated, and they have a national celebration day for a state. They give an honorary award called as Students Award. So this is named after a patient, Students. On that day, the families will be called upon, and the whoever has done the noble act of donating their organs subjects will be felicitated. And apart from this, the state government organizations on the when the days or after donation days, we are when celebrating them and when acknowledging them in front of the public, openly acknowledging them that because of them, then there is an average child in the end to be maintained to the donor and the recipient. You do not know the donor sequence happened at the secret. You do acknowledge the donation made by these families. So each and individual state governments in their capacities are trying to incentivize and increase the number of organ donations. So we should be committed.
We usually listen to the first. Okay, in this stick, what we this one of the case is
A young boy who died in a tragic accident in Italy a few decades ago. But this is to honor the family members of the deceased. This family was actually on a trip, and by some weird act of God, they were actually killed. Yeah. They were involved in a tragic accident, and the family member, the boy, was killed. But despite the family being on a trip in another country, the family finally came forward to donate the organs of that boy who was still in that country to donors in that country. Yeah. So I really doubt anything like that would have ever happened then or would ever happen ever again. Yeah. So for a family to come to terms with the tragic death of their loved one in a different country by an unnatural act, for them to come forward or donate the organs is it is just beyond words. I have to say, this is what we call the Nicholas effect. And after that story came to light, the disease organ donor transformation as a program received such a boost throughout the world, and this is referred to as the Nicholas effect. Yeah. So this family stood as a serious gesture of encouragement to the whole human world as such. Yeah. This is what we refer to as the Nicholas effect. Yeah. Earlier, we were discussing about how to boost organ donor transplantation. So the government is trying to make this disease organ donor transplantation or brain death certification part of the curriculum for most of the doctors, particularly those involved in general medicine, intensive care, neurologists, and neurosurgeons as well. I believe we have some postgraduate students here. Any of you from medicine or neurology, intensive care? Any of you? Which special medicine? Okay. Can you just tell us if the government or do you have in your curriculum anything about brain death satisfaction? Do you get chance to see cardiac patients? So please have a seat. Yeah. So what we want is in terms of training, every student that goes to general medicine, particularly intensive care, critical care specialists, neurologists, and neurophysicians, it has to be made mandatory in the curriculum with regards to brain death certification. And only then will doctors get the confidence to be able to potentially diagnose these patients.
somebody who's they're interested in often giving a story to organs. So what is it?
Our program is known as Jivanda, and earlier it used to be combined state with Jivanda, and lately as Telangana has their own Jivanda program. All you need to have is an Aadhaar link, Aadhaar, which is linked to your mobile phone. That's it. Nothing else is required. There is a series of questions which come and which work. It is the data of your name, age, sex, address, your phone number, that's it. And the Aadhaar information they ask. With that, you will be getting a generation of a voter ID, and you need to, of course, you need to know your nationality. So once you know, you enter the state into the APG1 portal, and it gives you online print itself, making a card on it. And now most of the individuals might think that if at all I register myself in that portal, tomorrow somebody will come behind me asking my order. It's not so. Again, if it is to impart the culture of or the promote the culture of individuals who live for the society. That's it. Again, at the end of the day, if something untoward happened to you, it is again the decision of your relatives or the family only to, even though you have a card on your name that whether you are a registered organ donor, this helps the hospital to come forward with asking, breaking the barrier and asking the question. Since that the family member has already registered for your organ donation, so would you like to consider again the organ donation? So it is quite easy. If any one of you is interested, can go home and just open the apjivanda.com and wherein you register organ donor. So wherein you just fill out the all the details and it will automatically do a printed testing. So just to also put this add on and missing, of course we can discuss only regarding brain dead, there is also one more entity called domain of the cardiac. So we do come across people wherein cardiac itself is again a complex topic. This has again 5 classifications, of which the third class is called controlled cardiac death. The rest of the 4 classes are called uncontrolled cardiac death. So where in controlled cardiac death meaning you know this individual is going to die. So controlly you make the family understand what is going to happen. Even we continue the sports and in their presence you remove the life support and immediately you take for it, control into the life support and take for the other measures. But the rest of the 4 characters, if something happens in outside the hospital and which are unattended. And the second thing is happened outside the hospital, somebody has done the CPR and brought it to the hospital. I mean, this is uncontrolled. And this is the third one. Then, if at all this same thing happens in the hospital in the ICU setup, and the fifth one is not at all in the ICU, present in the ward or somewhere, but all of a sudden developed a sudden cardiac event. And so these are all the possibilities. But the only problem with the donation of the cardiac deaths, of course, even if this program is there in the Total Act of our India, still not widely followed in India as much as brain death, heart donation to brain death. But the longevity or the graft functions are relatively less compared to that of the brain dead donors. So that is it. BCP has not gained that momentum as the brain death. So yes, with this, I like to say that medical community assets has to enhance their knowledge of the knowledge gap what is there in their understanding of the brain death. Once they are along with that brain death knowledge, so we need to actively discuss the options in case of the possibility of an inevitable. So what is there this is, and as Alex mentioned, you need to have a strong system. So this doesn't happen on a single day with a single person. Your entire system should be with collision with your approach. So only and only if that happens, this program will get success.
Thank you, sir.